What experts are learning about Lambda, a coronavirus variant of interest. The Lambda variant was first identified in Peru in December. The World Health Organization designates Delta as a variant of concern. Lambda is designated a degree lower as a variant of interest. What is known about Lambda? There is a lot left to learn about Lambda. The variant is not nearly as worrisome as the Delta variant in the US, which has been driving a rise in cases nationwide, but early studies suggest that it has mutations that make it more transmissible than the original strain of the coronavirus. Lambda has mutations that are concerning, but this variant remains quite rare in the US despite being around for several months. Dr. Preeti Malani, Chief Health Officer in the Division of Infectious Diseases at the University of Michigan in Ann Arbor, wrote in an email on Friday. It's difficult to know for certain how transmissible Lambda is and how well vaccines work. So far, it seems that Lambda is more transmissible than the original SARS-CoV-2 virus, which is similar to Delta and other variants, wrote Malani, an expert with the Infectious Diseases Society of America. SARS-CoV-2 is the name of the coronavirus that causes COVID-19. Thankfully, studies suggest that the currently available vaccines remain protective. We have learned during the pandemic that things can change quickly, so controlling spread of COVID-19 in general will help manage Lambda. Malani wrote. As long as there is uncontrolled spread of SARS-CoV-2, we will see more variants in the future. The only way out is widespread vaccination to control spread and prevent further mutation of SARS-CoV-2. It's a race between getting enough of the world vaccinated and the development of new variants that are less responsive to countermeasures. So far, data remains split on how well vaccines protect against the Lambda variant, and scientists say they need to study this more. Nathaniel Landau of the New York University Grossman School of Medicine and colleagues said their tests of blood taken from vaccinated volunteers shows that at least some of the newly emerging variants may evade the protection offered by a single dose of Johnson & Johnson's Janssen vaccine.
A boost of a second dose of J&J vaccine, or even with Moderna's or Pfizer's, might help, the researchers reported. In the study, the variants Beta, Delta, Delta Plus and Lambda showed only modest resistance against antibodies elicited by the Pfizer-BioNTech and Moderna coronavirus vaccines, suggesting the vaccines still work. Two additional mutations, T76I and L452Q, help make Lambda highly infectious. Currently, the Lambda variant has been flagged as a variant of interest by the WHO. We do not know yet whether this variant is more concerning than the Delta variant. Pharmacist and epidemiologist Dr. Ravina Kullar, who is an expert with the Infectious Diseases Society of America, wrote in an email on Friday. There needs to be extensive genomic surveillance studies that are done to assess how the vaccine's efficacy is affected by the Lambda variant, Kullar wrote. Until COVID-19 cases overall decrease, the best way to prevent the emergence of more variants is getting fully vaccinated, not traveling internationally, and following strict infection prevention measures including wearing a face mask, physically distancing from others, and not attending large social gatherings. A game of Russian roulette. Vaccines are vital to counter new coronavirus variants, such as Lambda, which might remain rare in the US but is associated with substantive rates of community transmission in multiple countries in the region, according to the WHO. Poland called it playing Russian roulette to allow virus to spread freely with no mitigations, such as wearing masks or getting vaccinated. We will continue to develop more and more variants, and eventually, one or more of these variants will learn how to evade vaccine-induced immunity, Poland said. And if that's true, we will start all over again.
Thank you for watching. Please subscribe.